All right, so what's this one? Case 4.
I can try this one. I kind of struggled with this. So initially it looks like we have a shave biopsy, maybe of a mucosal site. There's a lot of like clear cell change up top, and then part of it's eroded and ulcerated to the edge too. My first thought was, is this like PEH with pus, like pseudoepitheliomatous hyperplasia?
Excellent.
There's kind of up more superficially, but really neutrophils aren't found more in like the deeper areas. It's just kind of like lymphoplasmacytic inflammation.
So what do you think then? That's excellent description and very, very nuanced and subtle thing you picked up on that. Like regular when we think of PEH, pseudoepitheliomatous reactive epidermal hyperplasia with neutrophil aggregates with pus, we think of deep fungal and stuff like that, right? Bromoderma, iododerma, halogenodermas. And we expect the neutrophils to be down in the dermis, kind of in pockets underneath the PEH. But here we see a whole bunch of edema and like epidermis falling apart and keratinocytes kind of ballooning and getting real pale and swollen and tons of neutrophils. Then we see the pseudoepitheliomatous hyperplasia. And then down here, like you said, we see a dense infiltrate of plasma cells and lymphocytes. And you're right, this is mucosal. This is probably perianal would be a good site, or genital skin. So then what did you think, or what would your differential be?
So a differential for the top part, I wanted to see if maybe there was candida hiding in there.
Excellent.
But I don't think that would explain everything. And then also, I know we always have to think about syphilis with these like elongate redi and then plasma cells. So
Excellent.
I was somewhere in there.
Yeah, this is definitely syphilis, but you're right. Without the stain, you wouldn't be able to make it for sure. But this is a really nice example of Condyloma lata, which of course is a form of kind of warty overgrowth of epidermis in that I think is still considered secondary syphilis. My understanding of the way it's thought of is kind of an unusual variation of secondary syphilis. I've only seen these rarely in practice. I don't find them very often. They don't, to me, look very much like Condyloma acuminatum, which of course is the HPV-driven genital wart. But they do have kind of clinically look like that. I feel like they tend to be more flat plaque-likes rather than vegetative, kind of, warty looking clinically. I mean, I've seen pictures that look more warty, but I think the ones I've seen in practice were kind of elongated plaques, and all the ones I saw were in genital skin or perianal skin. And some of the things that help me is, in addition to epidermal hyperplasia, kind of psoriasiform elongated redi, even though it's really thick, thicker than regular secondary syphilis, you still get that long redi like you normally get in syphilis. Tons of plasma cells, although remember, in genital sites, plasma cells are pretty common in the dermis in a lot of settings, but it's always worth thinking of syphilis. And this up here, the few cases I've seen, this was pretty characteristic. A lot of neutrophils up in the epidermis, and there's edema and pallor and kind of a ballooning degeneration, almost like the ballooning degeneration you see like in hand, foot, and mouth disease. So those are clues to think of. I totally agree. If I had this case, I would definitely do a fungal stain here. I might even do a gram stain to see if there's some degree of bacterial impetiginization, and do a spirochete immunostain. Or if you don't have that, you can do one of the silver stains like Steiner or Worth and Staria, although, as we'll see a little later, I find those incredibly challenging to interpret technically. So this is Condyloma lata, variation of syphilis.